All right, so Carol, you are going to take the lead on this section.
Okay,
Car-
sure. Some of you may be familiar with the State Maternal Health Innovation Grant, which supports the South Carolina Maternal Health Innovation Collaborative to reduce severe maternal morbidity and mortality. Empower is one of the key innovations developed through the SCMHIC. Housed within the South Carolina Health Viz, the official SCMHIC homepage, which provides information on the grant's vision and goals, partner organizations, task force members, meeting materials, and other initiatives. Next slide, please.
Mhm.
Okay. Empower is a centralized digital hub that brings together maternal health resources and tools into one accessible platform for women, providers, policymakers, and public health professionals. Available across devices, desktop access is recommended if you're using advanced data visualizations. By consolidating resources statewide, Empower strengthens maternal health efforts across South Carolina, improving visibility, navigation, and awareness of available programs, services, and supports. This platform offers trusted information to support women during pregnancy and the postpartum period, including warning signs, next steps, and connections to services such as food assistance, legal resources, and healthcare. Today, I will briefly highlight two components of Empower, beginning with the Resource Hub, which is a centralized space that expands across maternal health education, peer support, and local services through community-based organizations. And you can see that the link to Empower is on this slide. Next slide, please.
Mhm.
Okay. The Empower Assistant is an intelligent AI chatbot designed to expand access to maternal health education, peer support, and local services provided by community-based organizations. When users submit questions, the chatbot draws on the Resource Hub to deliver relevant, trusted information and referrals. Resources are available in multiple languages, and Spanish is supported by the chatbot. Now, I want to emphasize that Empower does not replace existing dashboards or individual state resource websites, and it is not a substitute for professional medical advice, diagnosis, or treatment. Now, next slide, please. As we're referring back to that case study, if a healthcare professional wanted to find information on shelters located in the Columbia area and put that question into the chat bot. This is an example of the responses. There's South Carolina Housing, the Help for Homeless, and the Cooperative Ministry. So again, recognizing that we should not know it all. We don't have all of the resources, but this is a tool to assist professionals, um, patients, and to refer to patients and professionals to help them as it relates to resources. And some of those community-based organizations that we referred to earlier are also included in the resource hub.
And then, Carol, before we close out,
Mhm.
can I ask if someone says, "Hey, I don't see a particular resource on here that they know of. How can they get that information
There
to you?"
is there's an ability to provide feedback for the resource hub, and what we have done previously, we looked at that feedback, and then one of the priority focuses for this time was um, childbirth classes, fatherhood resources, food pantries, and things like that. So if someone from the community or a professional says, this is a need or this is an organization, then we will add that when we do our next quarterly update to the Resource Hub. Thank you,
Great.
Debbie, for that
Yeah,
question.
yeah, thank you. Because
Hmm.
this is a dynamic product, which
Hmm.
is makes it really exciting.
Hmm.
Okay, thanks, Carol.
Hmm.
So just to summarize, we're coming to the end of the hour, to say that we here at IFS and this team, we're creating materials, but also methods to support OB care teams, and OB care teams meaning, you know, obstetricians, certified nurse midwives, uh, nurses, social workers, anyone involved in doulas, community health workers, anyone involved in OB care. Um, so to creating those materials and methods to support team members to explore, address, and strengthen person-centered respectful care in their practice through the online modules that we reviewed very quickly, that will ultimately have CEU and CME credit options. We want to get the content right before, submitting the proposal for the credit options. And then we also have, we're developing facilitator materials to guide in-person sessions of varying formats. One example of that, was an in-person workshop that we held back in March with the South Carolina Primary Healthcare Association and their maternal health initiative. And they were very generous. We were there from 10 until 2 with a lunch break. So we were really able to dig into the content of each module and be very interactive. There was a lot of small group work. And we used the data, the quotes and such from Voces. It was exciting to see that 14 participants from the FQHCs around the state all left saying that they felt confident or very confident to bring what they learned back to the FQHC. They felt that the workshop was a good use of their time and they learned something new. And 13 of 14 said it raised their interest in using the online modules. So we'll be following up with them and keeping them engaged. Now we recognize that not that extensive 10 to 2 time frame is probably more in the rare situation. So we're also developing the materials in a way that they can be flexible to be used in a classroom, in grand rounds, in a conference workshop session, etc. So if you have ideas or you would like an in-person workshop, please reach out to us because we really want to be testing the materials, but also providing workshops that really help people to interact and problem solve around these issues. None of this is meant to be didactic, and we're really committed to that interactive problem solving component and approach to all of this work. I do want to mention that there are other respectful maternity care resources that are very important. We looked a little bit at the AWAN resources. They've also got other resources and are offering what they're calling, uh, was it gold, silver, and bronze designations for healthcare sites. That might be something that through BOI there'd be interest in pursuing. And then the National Institute for Children's Health Quality um, just came out and tomorrow has a webinar on resources to create a culture of respectful maternity care. I think what's important in terms of what we're doing here is that we are developing South Carolina specific resources that we hope will really speak to South Carolina based providers. So with that, we want to thank you and celebrating spring. These are some